This presentation is titled Effective Communication Strategies and Interventions for Individuals Diagnosed with Borderline Personality Disorders. Borderline personality disorder is an issue that impacts 2.7% of individuals in America. It's one of the most stigmatized and misunderstood conditions, and some symptoms of this disorder can lead to challenges with interpersonal communication, which is why it's really important that counselors learn effective strategies for maintaining positive communication with these clients. Untreated, BPD can lead to suicide, substance abuse, and considerable impairments in functioning. On the other hand, individuals with BPD are also capable of developing healthy coping mechanisms and leading meaningful lives with the help of effective therapeutic interventions. Borderline personality disorder is described in the DSM as a mental health condition characterized by pervasive patterns of instability in moods, self-image, and interpersonal relationships, as well as marked impulsivity. A patient has to meet at least 5 of the following criteria to be diagnosed with BPD: chronic feelings of emptiness, intense emotional reactions to daily events, frantic efforts to avoid abandonment, real or imagined, an unstable sense of self, impulsive behavior in at least 2 areas, such as spending, sex, substance use, binge eating, or reckless driving, intense anger that's inappropriate to the circumstances, a pattern of unstable and intense interpersonal relationships, recurrent suicidal or self-harming behaviors, and paranoid ideation or dissociative symptoms. BPD was added to the DSM in 1980, and its etiology is not entirely known, but it's thought to be a combination of genetic factors, neurobiological factors, and adverse childhood experiences. So that's another thing to keep in mind, is that many individuals diagnosed with BPD also have a trauma history to some degree. There are some important diversity considerations to consider as well. Women are diagnosed with BPD at a much higher rate than men, and white people are diagnosed at a higher rate than people of color, but this could be due to barriers to treatment for marginalized populations and the fact that more women seek treatment than men do. And lastly, it's important to keep in mind that often individuals diagnosed with BPD also have co-occurring conditions such as ADHD, PTSD, eating disorders, mood disorders. And so it's important to get a full picture of the person so that you know not just what their borderline personality disorder symptoms are, but what they're experiencing as a whole. Some important legal considerations that are important for anybody, but especially these clients, is to respect confidentiality, but be very clear about the limits to confidentiality and what that process would look like if you were to have to breach confidentiality and share something that they had said to you. It's also important to follow proper procedures in the instance of suicidal or homicidal ideation, and ideally this would look like thorough screening from the beginning, making a safety plan so that if these issues do come up, it's already established what the plan is and how you'll deal with it. Some ethical considerations are maintaining clear and consistent boundaries, defining the expectations of the counseling relationship at the onset of treatment, establishing routines, and finally seeking supervision to make sure that countertransference isn't an issue and that the individual's needs are being met. Some healthy communication strategies for individuals with borderline personality disorder are to set boundaries from the beginning, as I said, and clearly explain your role, the purpose of counseling. If the patient makes requests that are outside the boundaries of your role, connect them with resources, if appropriate. So maybe you get done with the session and they want a ride to the store. You could say, I'm not able to give you a ride to the store, but I see why it's important that you get there. Here are some local resources for free or discounted transportation. Avoid taking anything personally, and remember that it's not about you. The client's experience might be much different than yours. They might be experiencing reality different than you are. And the best thing to do is maintain open and neutral presence in body language and give the client space to express their feelings. Whenever possible, be clear and direct with your word choice to avoid the possibility of misinterpretation, and use a structured approach to keep the conversation on track. Now, if the conversation does veer off track and it starts to get a little tangential, you can gently guide the client back to the topic at hand. So this could sound like saying, I can tell the situation with your mom is really important to you, but I would like to finish talking about how you can cope when you're frustrated at work, because you said that's what you really wanted to talk about today. And then we'll go back to talking about your mom. So validating that all the things are important, but also keeping the conversation in a container so that it feels productive. It's useful to validate feelings first and then explore facts. So your client might be expressing some really powerful emotions that feel to you out of proportion to the events that happened, but those feelings are still very real to them. And so you might say, you felt like the entire world was crashing down on you. That sounds really overwhelming. And then ask, can you tell me what happened that may have triggered that? And try to get into what some of the actual events were. Avoid questions that encourage the person to make guesses about the intentions of others. This is really important. Be as consistent as possible. Do what you say you're going to do. Be predictable. Try not to make promises that you can't keep. And then lastly, connect the client with emergency resources so that you're not their only source of support. There are many effective evidence-based interventions for BPD, but dialectical behavior therapy, also known as DBT, is one of the most common. And this relies on the idea that two things can be true at one time. For example, both acceptance of what is and knowledge that some things need to change are both necessary. So both of those can be true. And this modality incorporates individual therapy, group therapy, homework assignments, and sometimes phone coaching as well. And it teaches skills related to mindfulness, distress tolerance, interpersonal effectiveness, and emotional regulation. Another common approach is schema therapy, and this incorporates elements of cognitive behavioral therapy and psychodynamic therapy. And it has to do with identifying maladaptive thought patterns or behavioral patterns and then figuring out how to change those. Mentalization-based therapy is a shorter term type of therapy than the other two, and this focuses on recognizing and understanding thoughts and feelings, both one's own thoughts and feelings, and being able to identify those and describe them, and the thoughts and feelings of others, being able to imagine how someone else might feel. And then the last major evidence-based approach is called systems training for emotional predictability and problem solving, often referred to as STEPS. And this is a manualized CBT-based group therapy program that, again, teaches emotion and behavior management skills with the goal of leading to greater stability. So here is a client scenario. Lydia is a client in an inpatient psychiatric ward. She was involuntarily checked in after a suicide attempt. Lydia tells you that it all started when her friend refused to come to karaoke with her. She got upset and told her friend that if she goes by herself and is sexually assaulted, it'll be his fault. She then tried to say she was just kidding, but he got frustrated and went home. She felt empty and lonely sitting in her apartment by herself, so she went to the bar and drank several alcoholic beverages. She started thinking about her ex-boyfriend, who broke up with her because she was feeling insecure, showed up at his workplace, and demanded he stop what he was doing and talk to her. At the bar, she sent him several angry texts, and when he didn't answer, Lydia walked into the parking lot screaming and crying into the phone. When someone walked by asking if she was okay, Lydia became convinced that this person was an undercover cop and was going to take her to jail. Lydia had been caught shoplifting earlier in the week, and that increased her paranoia. She wanted to get away, so she jumped in her car and started speeding down the highway. When she got home at 3 a.m., she called multiple people and no one answered, and at that point, she was so upset that she cut her wrist with a razor. A neighbor had seen her erratic driving and saw that she was emotional as she entered her house and had called in a wellness check, which led to Lydia ending up at the hospital. When asked how she's feeling now, Lydia says she doesn't even feel real. She isn't even sure who she is. She has a history of childhood trauma and neglect, and she's self-aware enough to realize that those past experiences are affecting her now. But once she gets triggered, she just can't seem to stop herself from repeating these self-destructive patterns. Lydia says that she makes friends easily but has a hard time keeping them. And she shares that the most frustrating part is that it feels like she's so worried that she's going to be abandoned that she ends up acting in ways that make those fears come true. So knowing all this, how can we help Lydia? The modality I selected was dialectical behavior therapy, and the frequency was weekly individual therapy and weekly group therapy. Anticipated length of treatment kind of depends on how effective it is and how long Lydia feels that she needs to stay in treatment, but it could be anywhere from 6 to 12 months. And the theoretical orientation is a combination of psychodynamic therapy and mindfulness. At the beginning of treatment, the first step is to build rapport with Lydia. Discuss her goals, her strengths, her protective factors, and what she hopes to accomplish in counseling. It's also important to learn a little bit about her childhood, her family of origin, any important cultural or environmental factors, all of the different external things that make up Lydia's life. At this point, we would also talk about informed consent, explain the role of a counselor, what to expect in sessions, talk about homework and how that works, and explain confidentiality. And in group therapy, we'd explain the norms of the group. And then at the beginning of treatment, we would also assess for suicidality and develop a safety plan if necessary, and also maybe utilize screeners like the PHQ-9 or the MSI for BPD. The first major goal for Lydia is to increase her emotional regulation skills and develop coping mechanisms to manage strong feelings. The first objective is that Lydia could keep a daily mood journal recording internal and external stimuli, her emotions, and her behavior. So what happened? How did you feel? What did you do? Second objective is that Lydia will identify 5 things she can do to distract herself from intense negative emotions. And DBT is really helpful for that because there's very concrete strategies like grabbing a cold piece of ice or doing high intensity exercise. So things that get you into your body and out of your head. And then the third objective is that Lydia will identify negative thoughts that lead to distress and practice coping statements to combat these thoughts. And these could be positive affirmations, or they could even just be neutral statements of acceptance, like all the events have led up to this point, or I don't have to like what's happening, but I will get through it. The second goal for Lydia has to do with her relationship with other people. Lydia wants to increase interpersonal effectiveness in order to reduce loneliness and conflict with others. To do this, Lydia could keep a log of conflicts she experiences and identify unmet needs, feelings, behaviors, and consequences. She could practice effective strategies for making requests and asserting her needs. And she can participate in group therapy in order to practice appropriate sharing and active listening. Lastly, and very importantly, Lydia wants to reduce self-harming behaviors and create a safety plan for instances of emotional turmoil. Lydia can identify at least 5 professional or natural supports that she can reach out to in a crisis and post their numbers somewhere she can easily access. She can identify triggers that lead her to self-harming behaviors and identify other alternative actions. And then lastly, Lydia can also work on identifying what thoughts and feelings and triggers lead to these actions so that she can be better prepared when she encounters those. So, in summary, people with borderline personality disorder are capable of having meaningful and successful lives, and therapists are capable of developing quality relationships with these clients. So in order to do this, we need to be genuine, we need to be consistent, compassionate, and model appropriate boundaries. There are multiple evidence-based modalities that have been shown to be effective for BPD, and the main thing they have in common is that they're structured approaches that teach concrete skills and combine introspection and collaboration. And what individuals with BPD really want, for the most part, is to feel connected and safe and in control of their thoughts, feelings, and behaviors. And even if they do experience unique challenges with this diagnosis, these are universal human needs, and the practices that help individuals with BPD are helpful to everyone. Here are my references, and thank you for listening.